Hello, prospective ChartSAS developmental and operations project partner. Please afford me 10 minutes of your time with 10 slides to describe how you can support the launch of the Cloud Healthcare Appliance Real-Time Solution as a Service, an IT concept for transforming medical practice and healthcare delivery by enabling healthcare provider subject matter experts to create and operate mobile apps for cognitive support to mitigate medical mistakes and to optimize case outcomes by leveraging evidence-based medicine to automate care episode management. Thanks in advance for your interest and attention.
Meet Dan and Maria. Dan needs to go to the hospital for a scheduled surgery. Dan and Maria aren't concerned because hospitals are safe places, right? Unfortunately, not always. Hospitals are busy, complex places where many very talented and dedicated people do remarkable work and save lives every day. In hospitals with strong leadership and teams that work together, patient safety is a top priority. Strong teams reduce infection rates, put checks in place to prevent mistakes, and create strong lines of communication between hospital staff and patients and families. All people make mistakes, but when there's a good team in place, they can look out for each other. But some hospitals don't have teams that work well together or good leadership. When one person makes a mistake, there isn't a good team ready to catch that mistake, and the patient suffers. Communication breaks down and patients get harmed. Patients experience dangerous complications, recovery is slower, and some patients even die unnecessarily. Let's take a look at two of the most common harms patients face. These harms are mistakes with medicine and infections that could be prevented. More than 1 million times a year, patients in the U.S. are given the wrong medication or the wrong dose of a medication while in the hospital. Even the best doctor or nurse can make a tiny error with really big consequences. And every year, 1 out of every 25 patients develops an infection while in the hospital. An infection that didn't have to happen. The most shocking side of the hospital safety problem is that as many as 440,000 people die each and every year because of hospital safety problems.
Healthcare complexity, that is, medical practice and healthcare delivery, creates intensive cognitive overload. For example, each doctor works in various venues to treat time-critical cases that are information-intensive, and he or she does this on a continuing basis for each of, on average, 3,000 patients. Well-known and long-standing safety organization programs make the problem worse. Because the time-critical and information-intensive nature of medical practice and healthcare delivery exceeds human cognitive capacity, causing cognitive errors, that is, degraded memory, analysis, and deduction. Therefore, the root cause of medical mistakes is cognitive overload. But current safety improvement programs emphasize only human factors and heuristic methods, which exacerbate human cognitive overload. Therefore, providers need better cognitive support. Whereas cognitive overload causes medical mistakes because medical and healthcare practices and procedures are critical, complicated, and constantly operating, whereas medical and healthcare venues are extraordinarily varied, dispersed, and chaotic, and whereas human cognitive capabilities are exceeded by medical practice and healthcare delivery complexity and process requirements, therefore, healthcare provider subject matter experts require tools and methods to create cognitive support that are continually available, reliable, simple, and secure, and that are inexpensive and do not rely on current information technology staff and systems. ChartSAS enables the required IT cognitive support. The Cloud Healthcare Appliance Real-Time Solution as a Service, or ChartSAS, is the tool set that providers need to create mobile apps for an always-on cognitive support capability. ChartSAS is an integrated software development environment designed for do-it-yourself use by licensed accredited healthcare provider subject matter experts having no IT skills. ChartSAS is implemented at a HIPAA-certified Internet Cloud data center operated by a commercial cloud service provider, or CSP, to ensure secure and reliable IT support. ChartSAS is accessible anywhere, anytime via an Internet-connected digital device and secure Internet portal such as eBay to create and operate mobile applications, also known as apps. ChartSAS leverages the subscriber's electronic health record or EHR systems and other on-premise IT systems and data sources using HIPAA-compliant interoperability software tools and methods. And for revenue streams, ChartSAS includes monthly subscription plus usage-sensitive IT resource charge, advertising income for display ads posted on the ChartSAS desktop, and ChartSAS digital artifact sales. Here's an example, a fatal example, of the so-called handoff communication error as reported to the Joint Commission and published in its document The Source in April of 2015. Quote, a healthcare system submitted a root cause analysis, or RCA, to the Joint Commission for a sentinel event that involved a patient whose blood levels were not drawn frequently enough to monitor the thinness of her blood while receiving a continuous heparin infusion. The patient had been started on a heparin infusion on an orthopedic unit and then was later transferred to a cardiac unit. The order set for the heparin infusion was not entered properly, leaving out the automatic order for blood tests every 6 hours to test blood viscosity. During the handoff report, the nurses did not discuss whether the next blood test would occur and when, nor to monitor the heparin infusion. For 24 hours, the patient went without blood tests until an oncoming nurse questioned the situation during the handoff report. At this time, the outgoing nurse also reported that the patient had been complaining of a headache for several hours. A computerized tomography or CT scan showed intracerebral hemorrhage. When the patient's mental status deteriorated, the family chose not to proceed with surgery due to the patient's multiple comorbidities and recent decrease in quality of life. The patient expired 3 days later, end quote. Here are the steps that a healthcare provider could follow using ChartSAS to mitigate the fatal handoff communication error that we just learned about. Step 1, surf to chartsas.com and apply for a subscription status. Step 2, receive an email approving application, presenting some disclaimers for ChartSAS use, and providing the user ID and password login credentials. Step 3, surf to the ChartSAS secure portal and log in using the ID and password provided. Step 4, view the ChartSAS desktop and select the icon representing the feature to be used. Step 5, use the workflow feature, selected in this case, to design the app required to mitigate handoff communication errors. And step 6, push a software button to automatically create the mobile app, one screen which is shown on the slide. This slide employs the swim lane flowchart paradigm to depict how the mobile app just created by a provider using ChartSAS would operate to prevent a patient death by mitigating a handoff communication error. The app is depicted in the bottom row, boxed in green, operating in real time in conjunction with the other actors depicted in the other so-called swim lane rows, labeled on the left of the chart from bottom to top as follows: the installed electronic health record or EHR system, the nursing staff on the hospital surgical unit 2, nursing staff on the recovery unit 1, the medical provider, in this case a surgeon, and the patient upon whom the surgeon operated. The app operates non-stop 24/7 and is designed to monitor the occurrence and content of updates to the EHR patient record and to report problematic events. In this case, the app would deduce that the required blood type 1 heparin-induced thrombocytopenia or type 1 HIT test had not been performed within the 6-hour time interval since the previous test, because the app did not detect the occurrence of an update to the patient's EHR case record type 1 HIT test result data field. Therefore, the app would notify the implicated clinical staff member or members via their associated mobile or other digital devices of the emergent need to perform the ordered test and to read the result. Thereby, the medical error of omission would have been avoided and the patient's life would have been saved. Only $100,000 will fund the completion and initial operation of ChartSAS, Lesser amounts will serve to implement the basic cloud-based architecture and key components. Alternatively, as a licensed or accredited healthcare provider, professional, or organization, you may choose to support the ChartSaaS DevOps project by participating as a consultant or a developmental or experimental user. Please contact me via phone or email to discuss our next steps as partners in transforming medical practice and healthcare delivery with the Cloud Healthcare Appliance Real-Time Solution as a Service. Thanks for your consideration and good wishes for another great day.